Black women, because of the pandemic and because of the racial disparities combined with the pandemic, are experiencing things like difficulty sleeping, low mood, anxiety.
The pandemic has not affected racial groups the same.
Black women, 58% of them said that they had been furloughed or lost their jobs, compared to 31% of white men and compared to 32% of white women. 3 times as many Black people compared to their white counterparts have died from COVID.
Today, we're seeing death rates in the city of Chicago up to 6 times that of the white people.
4 times the number of Black people have been hospitalized for COVID.
To understand why we're seeing this, because many of us predicted this, we have to understand that heading into the pandemic, Black and brown people were at a significant disadvantage in our current healthcare system. And what I mean by that is they already had decreased access to healthcare. They already had to deal with decades of racist policies. If you look at, the average white woman today, for example, more likely to have access to a high-paying job. Well, I'll say a job that's higher paying than an average Black woman. That means you're also more likely to have access to healthcare, more likely to be employer-based insurance.
Black people are more likely to be essential workers, which means grocery store workers, working in the mail services, things that never shut down, and things that did not have the opportunity for people to work from home easily. Black women are more likely to function as caregivers. They're more likely to be single moms. We know that Black women are more likely than their white counterparts, than white women, to say essentially that they spend several more hours caring for their parents, elderly relatives, and children. And so when you think about the added stressor of then grieving the loss of a family member or losing the income that family member brings, I think it's a huge burden then that Black women have to take on in this time.
It's an economic toll, it's a physical toll, but also it's a mental health toll. We're dealing with the COVID pandemic, disproportionate death, that's trauma. And then also dealing with the racial pandemic that is on top of it.
Say her name!
When we're looking at the current events around police brutality, around civil unrest related to racial disparities, it's important that we understand that these are very triggering events across all sectors of society in terms of socioeconomic status for Black people, and in particular Black women. I think it's easier for people to understand when we talk about veterans and the triggering nature of coming back from war and then having an event happen that causes you to re-experience aspects of what you might have experienced in war. This is what racial trauma is about.
I think we have to look at the mental health toll. We have to start understanding that the racism that we live through, the oppression that we live through, it's a trauma. It's an actual trauma that we carry in our bodies, that affects our health, that affects our minds.
We have to consider how increased risk of things like depression and anxiety translate into increased risk of other health conditions like diabetes, hypertension, cardiovascular disease, high blood pressure, or exacerbation of conditions like asthma. So it's a feedback loop.
And as we think about how we're gonna regroup, how we'll heal from this, we can't leave out the mental health piece, because the damage is very real. And long after the pandemic, the ghosts of what we're living through will continue to exist. And certainly until our racial oppression lifts, we will continue to suffer ill physical and mental health effects as well.